Surgical removal of colon cancer can be performed using various approaches. The operation itself always remains the same, but surgeons can access the abdominal cavity and the pelvic cavity either by the open method, which involves making a large incision in the anterior abdominal wall. Alternatively, the procedure can be done laparoscopically, where instead of a large incision, several small punctures are made. Through these, a long camera is inserted, and the image is displayed on a large screen in the operating room. Long instruments are also introduced, allowing the surgeon to operate inside the abdominal or pelvic cavity and perform the same surgical procedure as with the open method. And the third method now available is robotic surgery, which is also performed through small punctures or incisions in the anterior abdominal wall. A special camera is also inserted inside, and the image is displayed on the screen of the robotic system. However, the instruments themselves are not held directly by the surgeon and assistants, but by a special robotic system. The surgeon controls this robotic system through a special console, which is also located in the same operating room, just a few meters from the operating table. At the same time, the surgeon can fully control all the instruments almost independently. An assistant is not required, and thus the human factor is eliminated, along with possible mistakes or oversights associated with having a large number of people in the operating room. The surgeon has complete control over the camera and the instruments and can see everything happening inside the abdominal cavity on a large screen in front of them in 3D, not just a flat image, but a volumetric view, just as they would see during an open surgery. But during open surgery, the distance to the surgical site is more than 50 centimeters, whereas during robotic surgery, the camera can get very close to the area of operation. The operation itself can take place in a very small space, which means that even the tiniest blood vessels, nerves, and lymph nodes become visible, allowing the surgeon to preserve all the important nerves and vessels. Removes even the smallest lymph nodes during such operations. Such an operation is performed almost bloodlessly. And most importantly, these working instruments have a very high degree of mobility, unlike laparoscopic instruments, which are always straight. And since we insert them only through fixed punctures in the anterior abdominal wall, their mobility inside the abdominal cavity is very limited. Robotic instruments can bend in different planes. They even have more degrees of freedom than the human hand, meaning they surpass even open surgeries. They can rotate in 7 planes, all while operating in a very confined space. And a major advantage of both laparoscopic and especially robotic interventions is the reduction of the inflammatory response compared to, for example, open surgeries. People feel much better after such operations and recover more quickly. And since the inflammatory reactions are much less pronounced, this also helps prevent both local and distant recurrences.